Okay, so Mr. Rogers, I'm gonna do a little bit of teaching. Is that okay?
Yes.
Okay, right. So because you have diabetes, I'm gonna do a little bit of teaching on hyperglycemia and hypoglycemia. So hypoglycemia is when you don't have enough sugar in your blood, and it can cause dizziness. It can cause nervousness, anxious, irritability. You can also have some confusion. Some ways to prevent that is making sure that you check your blood glucose several times a day. Make sure you don't skip any meals or delay any meals or snacks. If you decide to drink alcohol, make sure you eat a snack or eat a meal with it. Hyperglycemia is when you have too much sugar in your blood. And some of the signs and symptoms of that is increased urination, increased thirst or hunger, blurred vision, headache. And ways you can prevent that is by also checking your blood glucose several times a day. Avoid smoking, limit your alcohol intake, and try to maintain a healthy weight. And also, I want to encourage you to turn every 2 hours to prevent further skin breakdown. And I've seen that you take morphine for pain. Some of the side effects of that are nausea and vomiting, constipation, and to prevent constipation, you can increase your fluid intake. You can also have respiratory depression if you get too much of it. You also take simvastatin, and that is to treat cholesterol and triglyceride levels. That will also help prevent heart attack and stroke. Some of the side effects of that medication are headaches, difficulty sleeping, and weakness. Also, if you have any changes in your urination, like burning or painful urination, fever, lower back pain, or even blood in your urine, you want to make sure that you report that to the healthcare provider. For your diet, you want to make sure that you follow a strict diet to keep your blood glucose level low, or not low, but in a normal range. You want to make sure that you increase your protein and complex carbs like oatmeal, brown rice, fresh fruits and vegetables, chicken, turkey, stuff like that will help. Also, you want to make sure that you stay hydrated. And the purpose of the wound dressing that I did was to protect the wound from being contaminated. It also aids in homeostasis, and it also protects or promotes wound healing. Okay, so do you have any questions?
No.
Okay, and could you give me a little bit of feedback on what you learned today? With like hypoglycemia? We can start with that one.
Hypo is whenever you don't have enough sugar in your blood, and it can cause you to be anxious and
irritable. It can also cause for you to be dizzy. And what about hyperglycemia?
Too much sugar.
Yes.
In my blood.
Yes. And remember, it can cause blurred vision. It can cause headache. Okay. And what else did you learn? You want to make sure that you are turning every 2 hours.
Yeah, to make sure that I don't get any more like skin things.
Skin breakdowns.
Breakdowns, yeah.
Yes. And morphine. What are some of the signs and symptoms of morphine?
Side effects?
Yeah, sorry. Nausea, vomiting.
Yep.
Nausea, vomiting, constipation.
Which fluids would help with?
Yes. And I also need to make sure that I am following a strict diet. I need to make sure that I eat more proteins and complex carbs like oatmeal and brown rice and chicken, turkey. Eat more vegetables and fruits. I need to make sure that I turn every 2 hours. The purpose of the wound dressing was to prevent prevent it from being contaminated with microorganisms, and also it promotes wound healing. Okay, Mr. Rogers. Is there anything else I can do for you?
No, thank you.
Okay, alright. Okay, alright. So I'm gonna make sure that the bed is in the lowest position. The rails are up. Your call light is within reach. I'm gonna open the door and wash my hands. You can stop.